So I'm just going to start off by performing hand hygiene. And today's date is March 10th, 2020. The time is 7:50, and I'm going to begin my first check. Nursing Jake, fin number 312, fin number 312, 654, 654, 987, 987. Birthday is January 1st, 1960, 1960. No known allergies, no known allergies. This medication was ordered on March 10th, 2020 at 6:30, March 10th, 2020 at 6:32. All my medications were ordered on March 10th, 2020. Each of my medications has 2 transcribers, so I know this medication can legally be given if it's at the appropriate time. Docusate sodium, suspension, 60 milligrams, POBID. So this medication is scheduled to be given twice a day at 0800 hours and 2000 hours. The next scheduled dose is to be given on March 10th at 8 a.m. Today is March 10th, 2020. The time is 7:50. The 8 o'clock dose has not been given yet, so I know this is safe to give. Latanoprost, eye drop, 0.005%, 0.005% to the right eye, daily, 2 drops, at HS bedtime. So this medication is scheduled to be given once a day before bed at 2200 hours. The next scheduled dose is to be given on March 10th at 2200 hours. Today is March 10th, 2020. The time is 7:50. So I know it is too early to give this medication yet, so I will not be giving that medication. Levofloxacin, 500 milligrams, PO daily. This medication is scheduled to be given once a day at 0800 hours. The next scheduled medication is supposed to be given on March 10th at 8 a.m. Today is March 10th, 2020. The time is 7:50. The 8 a.m. dose has not been given yet, so I know this is safe to give. Ramipril, 10 milligrams, PO daily. This medication is scheduled to be given once a day at 0800 hours. The next scheduled dose is to be given on March 10th at 8 a.m. Today is March 10th, 2020. The time is 7:50. The 8 a.m. dose has not been given yet, so I know this medication is safe to give. So I'm just going to get my medications out. Docusate sodium, 1% solution. I know that's the same thing because I have checked. Suspension, this can be given as a suspension, and this is not expired, so I know this is safe to give. The eye drops I will not administer yet because it's too early. Levofloxacin, PO. I know these are oral tablets, and it is not expired, so this medication can be given. Ramipril, PO. I know these are oral tablets, so this can be given safely, and it is not expired, so I know this medication is good to give. So I can put my physician's order sheet to the side because I am done with that now. And I'm just going to perform hand hygiene again and prepare my medications. So Docusate sodium, 1% solution. I know that's the same thing because I checked. I need a suspension of 60 milligrams. My concentration is 10 milligrams per milliliter. So by my calculations, I would need 6 milliliters in my suspension. So I'm just going to shake my bottle. And I'm approximately going to put 10 milliliters into my cup. And I'm going to fill my syringe up here. Make sure we have no bubbles. Perfect. So I'm going to fill that up to 6 milliliters. So I have 6 milliliters in my syringe and I don't have any bubbles. So that's 6 milliliters on my syringe and no bubbles. So I'm just going to put this in my med cup so I don't contaminate it. And this is med waste, and I'll put the cap to the side. And I can make my label for this medication. So, Nursing Jake. My drug name is Docusate sodium. 1% solution. My dose is 60 milligrams. My volume is 6 milliliters. My concentration is 10 milligrams per milliliters. The date is March 10th, 2020 at 7:50. My signature is AVUMSN2. Perfect. So that is my med label for that medication. So I'll put this down and I can begin my next medication. So I'm not going to prepare the eye drops because it's too early. So I have levofloxacin, 500 milligrams. The concentration is 250 milligrams per tablet. So I know I have to give 2 tablets here. Perfect. So I'm nursing Jake. The drug name is levofloxacin. The dose is 500 milligrams. The volume is 2 tablets. The concentration is 250 milligrams per tablet. The date is March 10th, 2020 at 7:50. My signature is AVUMSN2. So that is my label for my next med, and I have 2 tablets in my med cup. So my last medication, ramipril. I need 10 milligrams. My concentration is 10 milligrams per tablet, so I need to administer 1 tablet of medication. Perfect. So nursing Jake. Perfect. Nursing Jake. Drug name is ramipril. The dose is 10 milligrams. My volume is 1 tablet. My concentration is 10 milligrams per tablet. The date is March 10th, 2020 at 7:50. My signature AVUMSN2. So that is my label, and I have 1 tablet in my cup. So now that I have prepared all my medication, I can do my second check. So I'm just going to wash my hands and begin my second check. So I have nursing Jake, docusate sodium, 1% solution, docusate sodium, 1% solution, and I have checked, and that is the same thing. Suspension, I have a suspension here, 60 milligrams. My concentration is 10 milligrams per milliliters. Concentration 10 milligrams per milliliters. Therefore, my volume is 6 milliliters, and I have 6 milliliters in my syringe with no bubbles. PO, I know this is an oral suspension, BID, twice a day at 0800 hours and 2000 hours. The next scheduled dose is to be given at 8 a.m. on March 10th. The date is March 10th, 2020. The time is 7:50. The 8 a.m. dose has not been given yet, so I know this is safe to give. My signature is AVUMSN2, so I know this medication is good. I can put this away. And I can't give the eye drops yet because I know it's too early. So I have nursing Jake, levofloxacin. 500 milligrams. My tablet concentration is 250 milligrams per tablet. My concentration is 250 milligrams per tablet, so I know I have to give 2 tablets, so my volume is 2 tablets. I have 2 tablets in my med cup. PO, I know these tablets can be given orally, daily, so once a day at 0800 hours. The next scheduled dose is to be given on March 10th at 8 a.m. The date is March 10th, 2020. The time is 7:50. The 8 a.m. dose has not been given yet, so I know this medication is safe to give. And I have signed my label, AVUMSN2. So this medication is good to give. My last medication, nursing Jake, ramipril, 10 milligrams. My concentration is 10 milligrams per tablet, so I know my volume has to be 1 tablet, and I have 1 tablet in my med cup. PO, I know these can be given orally, daily, so once a day at 0800 hours. The next scheduled dose to be given is on March 10th at 8 a.m. Today is March 10th, 2020. The time is 7:50. The 8 a.m. dose has not been given yet, so I know this is safe to give. I have signed my label, AVUMSN2, so I know I can give this medication. So now that I'm done preparing all my meds, I can put my meds away. And my med waste. And my lid. And I'm just going to grab a cup of water to give because all my medications are oral, and I'm just going to perform hand hygiene as I leave the room. So I'm going to bring my med tray and my MOR with me. So I'm going to enter my patient's room. I'm doing a quick safety check, no hazards, my patient is safe. Good morning, my name is Alisha, and I'm going to be your student nurse for today. And I'm here to give you your morning medications. Could you please tell me your full name? Jake Nursing. Perfect, Jake, how are you today? That's good. Is it okay that if before I give you your medications, I check your ID band? Perfect, thank you. So Nursing Jake, FIN number 312, FIN number 312, 654, 654, 987, 987. And could you please tell me your birthday, Jake? January 1st, 1960, perfect, that's what I have. And do you have any allergies? No, you don't? Perfect, that's what I have here. So I'm just gonna put your bed, I'm just gonna raise your bed so I can give you your medication here, and I'm gonna put you in a high Fowler's position, in a sitting position, just because we are giving you oral medication, so I do want the medication to go down properly. Are you okay? Perfect. So is it okay if I do my third check of my medication before I give them to you? Perfect, thank you. So I'm just gonna wash my hands again and perform my final check. So I have here Nursing Jake, Docusate sodium, 1% solution, and I know that's the same thing because I have checked. Suspension, I have a suspension here. 60 milligrams, PO, I know this is an oral suspension, BID twice a day at 0800 hours and 2000 hours. The next scheduled dose is to be given on March 10th at 8 a.m. The day is March 10th, 2020, the time is 7:50, and the 8 a.m. dose has not been given yet, so I know this is safe to give. My concentration is 10 milligrams per milliliters, so my volume is 6 milliliters. And I have 6 milliliters in my syringe with no bubbles. Perfect. So I know it is safe to give this medication. And I've signed my label, AVUMSN2, perfect. So my next medication, so the eye drops is too early to give, so I won't be giving them yet. So my next medication here, Nursing Jake, levofloxacin, 500 milligrams, PO, I know these medications have to be given orally, and these tablets can be given orally, daily, so once a day at 0800 hours. The next scheduled dose is to be given on March 10th at 8 a.m. The date is March 10th, 2020, the time is 7:50. The 8 a.m. dose has not been given yet, so I know this is safe to give. My concentration is 250 milligrams per tablet, and so my volume is 2 tablets, and I have 2 tablets in my med cup. And I've signed my label, AVUMSN2, so I know this medication is good to give. My last medication I have here is Ramipril. So my last medication here I have is Nursing Jake, Ramipril, 10 milligrams, PO. I know this tablet is given orally, daily, so once a day at 0800 hours. My next scheduled dose is to be given on March 10th at 8 a.m. Today is March 10th, 2020, the time is 7:50. The 8 a.m. dose has not been given yet, so I know this is safe to give. My concentration is 10 milligrams per tablet, so my volume is 1 tablet, and I have 1 tablet in my med cup. I have signed AVUMSN2, so I know this medication is good to give. So I've checked all my medications again, Jake, so I can administer you the medication now. So I'm just going to wash my hands again. So the first medication I'm going to give you, Jake, is your Docusate sodium. Your Docusate sodium is for your constipation. It's a stool softener. And so with this medication, I am going to be monitoring your bowel movements, so the frequency of how much you're going, and if there's anything unusual in your stool, like any blood, and I will also be monitoring your input and your output. And do you know when your last bowel movement was? Perfect, I'll make a note of that. And some of the side effects of this medication are cramping, diarrhea, and vomiting. So if you do have any of those symptoms, please do let me know. And with this medication, I will ask you to maintain proper hydration. So having 8 to 10 glasses of water a day could really help prevent dehydration. Okay, so I'm just gonna get your DocuState sodium. So is it okay if I give you your DocuState sodium? Yes, perfect. Perfect. So the next medication I'm going to be giving you is your levofloxacin, because it's too early for eye drops. So your levofloxacin is an antibiotic. It's given to you to treat your pneumonia infection. And some of the side effects of this medication are headache, dizziness, and drowsiness. So I will be doing a blood test, a CBC test, a complete blood count, to monitor especially your white blood cells, to make sure that the medication is working and the infection is going down. And before I give you this medication, I am going to check your vital signs, especially your temperature, to make sure you don't have a fever. And I'm also going to be doing a respiratory assessment on you because you do have a respiratory tract infection. So I am going to listen for any adventitious sounds. I will be coming back in 10 to 15 minutes later again to assess your vital signs again, especially the temperature, to make sure you don't have a fever. And I am going to be doing another respiratory assessment later on in the day to again listen for any adventitious sounds and see if anything changed within the day. And so some of the side effects of this medication again are headache, dizziness, and drowsiness. So like I said, I will be monitoring your white blood count, but I'll also be monitoring for any super infections. So for example, any diarrhea or a coated tongue. And while you are taking this medication at home, I will ask you to comply with the proper regimen. So taking the medication at the right time, the right dosages, and the right frequencies, just to completely clear that infection. Also, I'll ask you to maintain proper hydration, the 8 to 10 glasses of water, and I will ask you to take this medication on an empty stomach. And again, with this medication, since it does cause drowsiness, I will ask you to not drive because it is a hazard, and you are at a risk for fall because of the drowsiness, so please don't hesitate to use your call bell, and because we are here to help. So I am going to assess your vital signs now and your temperature and do your respiratory assessment, and I have determined that it is safe to give you your medication. So is it okay if I give you your levofloxacin, your antibiotic? Yes? Perfect. Thank you. So your last medication I'm going to give you is your Ramipril. Your Ramipril is your antihypertensive medication. So this one is for your hypertension, your high blood pressure. So what this is going to do is lower your blood pressure. So some of the side effects of this include headache and dizziness. So before I do give you this medication, I want to check your blood pressure to make sure that it's not already low, because you could go into hypotensive state, which is abnormally low blood pressure. I'm also going to check your apical heart rate because this medication can also lower your heart rate. And I'm going to come back in 10 to 15 minutes again to check that blood pressure and the apical heart rate, and also at the peak and onset of this medication. So like I said, I will be monitoring your blood pressure and your apical heart rate throughout the day. I'll also be monitoring your input and your output, your daily weight, and I will be getting a blood test done for this as well to monitor your electrolytes. So again, if you do feel any of the symptoms of headache and dizziness, please do let me know. And while you're taking this medication at home, please make sure you comply with the proper regimen, just to get that full proper control on your blood pressure, and to avoid any sudden position changes, because you could get postural hypotension, which is an abnormally low blood pressure because of the sudden changes. And avoid any alcohol or smoking while you're on this medication. And I would ask you to monitor your blood pressure as much as you can at home, just to make sure that it's not abnormally low throughout the day. So I am going to check your blood pressure and your apical heart rate now. So I've checked that and I've assessed that it is safe to give you this medication. So is it okay if I give you your Ramipril, your blood pressure medication? Yes? Perfect. Perfect. and you've swallowed all your meds safely now. So I'm gonna just sign my MAR now before I leave the room. So I gave the DocuState sodium, so I will sign AVUMSN2 at 750. I didn't give the eye drops, I gave the levofloxacin, AVUMSN2 at 750. The Ramipril, AVUMSN2 at 750. So now that I've given you all your meds, I'm gonna go document whatever we did here today. So I am gonna lower your bed here to the lowest position, and I'm gonna come and check on you in 10 to 15 minutes, again, to just check the blood pressure, apical heart rate, your vital signs, especially your temperature, and monitor your ins and outs and get the blood work started. And I am gonna be checking your weight later on and also doing a respiratory assessment later on in the day. So I am gonna leave you sitting up here in the high fowlish position for 10 to 15 minutes, just so all the medication we gave can go down properly. So if you do have any questions, please don't hesitate to ask me. And that is it for today. So I'm just gonna do a quick safety check. Everything looks good. The call bell is in reach for the patient. The patient is not in any danger. And I can take my med tray and my MAR since it's signed. And I'm just gonna perform hand hygiene as I leave my room and take my things. And I'll just show my MAR here, AVUMSN2 750. I didn't give the eye drops. Levofloxacin, AVUMSN2, Ramipril, AVUMSN2 750, and that's it.